Thank you for your support so far. Today, I'd like to share a personal experience. Recently, I had a blood test done at my local blood collection place. I'd like to give a shout out to, to Judy, who worked on Sundays when I went. She was an excellent venipuncturist, and some of the things that really stood out was her attention to detail. She checked the details twice over. She made sure the blood tests were correct, and her technique was flawless. I felt a little bit of discomfort, but it was only instantaneous. Blood tests have been around for quite some time and is an essential tool of doctors in terms of the diagnosis and management of disease. I'd like to take some time today to talk a little bit about blood tests. A quick disclaimer before we continue. The information presented is general in nature and use at your own risk. Complex concepts may be oversimplified for entertainment purposes. Symptoms and medical conditions, as well as diagnosis and the treatment of these conditions, may be mentioned. The information presented do not constitute the practice of medicine nor replace medical advice from a licensed medical professional. Do not rely on the information to make decisions about your or someone else's health. Please seek help from a certified health practitioner if you have concerns or symptoms. You may not know that blood or the circulation system was described 500 years ago. It was only after the invention of the primitive microscope that scientists and doctors started to understand about the cellular nature of blood. Yet today, blood tests and also tests of other bodily fluids, including urine, saliva, stool, you name it. Any bodily fluid you can get from the body, we can test. But today I'd like to answer a couple of questions that I often get during consultations from patients, and hopefully hopefully by answering these questions, we'll highlight some of the key concepts of pathology tests. One common question that I get is, why is the needle so long and large? If you're an adult and you've had blood tests taken, you would most likely had what's known as a vacutainer system. And so in this particular modern system, it's to improve the flow of blood as well as to reduce needle stick injuries. The system is designed in several parts. Often you have a long needle with a cover to protect the person taking the blood or the venipuncturist to prevent needle injury. There is a needle holder, which is a plastic tube that goes over it, and then a specific number of tubes that go inside the holder. And each tube has a small degree of vacuum or suction, and the blood is drawn automatically. The reason that the needles need to be long and large is that with this particular system, the pressure is relatively low, and if you've got a very small needle, the flow can be impaired, and therefore the quality of the sample may be poor. The standard adult needle is 21 gauge, and that's just a measurement of the diameter of the needle. And again, typically the needle is slightly longer. That allows for the position of the hand as the blood is taken. You may also note that if you've seen children have their blood test taken, sometimes they use a smaller needle, which is like a little butterfly. It's a small needle attached to two plastic flanges. And in babies, we sometimes don't use needles at all. We squeeze spots of blood from their foot. Each of these have advantages and disadvantages, but at least in adults, for the time being, we're stuck with the larger needles. Scientists and doctors are working hard to change the way that we measure certain parameters. So, for example, in the area of diabetes or blood sugar management, things have changed dramatically. You may have seen family members previously use skin prick. They would get a little small needle and prick the tip of their finger. They'd squeeze out a drop of blood. Most recently, in the last couple of years, there are patients now using continuous blood glucose monitoring, which is a small plastic tip which is inserted underneath the skin, and it can stay there for days to weeks. The technology is slightly different, and the accuracy can again vary. I would always check with your health practitioner to see which one's the best for you. The second question I often get is, why do you always need so many tubes, doctor? Well, again, if you've had blood tests taken recently, you would have noticed that there are different colored tubes. And the tubes are different sizes, different widths. The reason for this is that as doctors, when we request specific tests, and that's important, sometimes patients mistakenly understand that we all order the same tests, and that's not true. So as doctors, we often order tests in a personalized way, depending on the patient's presentation, description of symptoms, and prior medical conditions. And each test, unfortunately, is run at a different part of the laboratory. So, for example, if we're looking at the blood cells, often the test is known as a full blood count or a complete blood count, CBC or FBC. Uh, in that situation, the sample needs to preserve the blood or the cellular component. On the other hand, if we're looking at the non-cellular or the serum or the liquid part of the blood, that often uses another set of chemicals to preserve that, and so on and so on. Question number 3, how long does it take to get the test results back? Well, this is a somewhat complicated question. It really depends on what tests were ordered, where the tests were taken, where where the main laboratory is, and the computer systems that are involved. So, in a large teaching hospital, in a large city, most blood tests can be turned around within minutes to hours. In a suburban center, perhaps we're talking about half a day to a day. In more rural or remote settings, it could take several days. And similarly, if there's very complex tests done, they can be batched up and again may take weeks to months to be reported. Next, my results are normal. Does that mean I'm not sick? And vice versa. Again, somewhat complicated question, and it really depends on your particular situation and the nature in which the blood tests were taken and the tests that were ordered. One common situation I see is a patient may come with a diarrheal illness, and we test the stool samples. The stool samples come back normal. And so does that mean that you didn't have a viral or bacterial infection? What you might not know is that most stool samples test for a set of common pathogens. However, there are pathogens that are less common or more difficult to detect. And so again, just because the stool samples came back normal, it didn't mean that you didn't have a viral or bacterial pathogen. Similarly, the reverse is true. Just because the test is abnormal, it doesn't mean that you're sick. Again, I would speak to your doctor regarding this. What you might not know is when you look at the blood tests, there is your value for the particular blood test, and then in the brackets next to it, there is the normal values. In general, the normal values account for 95% of the population. And so 1 in 20 people fall outside of that and therefore technically have an abnormal blood test. But it does not mean that you're sick. And the common analogy that I use is that we don't use height as a means of judging health. Just because you're tall or you're short, it doesn't mean that you're necessarily healthy or unhealthy. And again, so it's important to interpret the blood test in your particular context. And sometimes what can be helpful is seeing a trend. Lastly, should I always fast for each blood test? Again, that's a very interesting question. Look, fasting is only one particular instruction that we may give patients depending on the blood tests that are ordered. And in terms of fasting, it's typically for situations of blood glucose monitoring. Today, we can detect diabetes in other ways without a fasting blood test. And so I would speak to your health professional depending on special instructions. In actual fact, fasting can make blood collection more difficult as you may be more dehydrated. And in actual fact, most blood tests can be taken without fasting. There are many other factors that can affect blood tests that people don't realize. Again, it's important to speak to your doctor regarding these as well. For example, in menstruating women, the time of the month can affect certain blood tests, especially hormone profiles. Exercise can affect several blood tests. And so it's important to speak to your health professional regarding any special instructions. I hope today's session was helpful. And as always, please reach out if you've got comments or suggestions, and I'll see you next time.